Welcome, Impactful Parents. It's time for the Impactful Parenting Podcast, where I give you parenting tips and resources to make you a more impactful parent to your school-age child. I am your host, Kristina Campos. Why are you doing that? Stop. And that's exactly what I told my child when I discovered they were picking at their skin. No. Picking, that doesn't even describe it. It's more than just picking at your skin. It's picking at the body and doing it so much that it leaves bald spots, scarring, and can even strike blood. It's called Trichotillomania and Dermatillomania. Hello, my name is Kristina Campos. I'm founder of The Impactful Parent, and every week I give you parenting videos to help you in your parenting journey. If you have a particular topic or parenting question about your school-age child that you would like for me to address, please submit it at theimpactfulparent@gmail.com or by messaging me on social media, and all submissions are kept anonymous. But today, we're going to talk about a common disorder where kids pull their hair, and it's called trichotillomania. Or they could be picking at their skin, and that's dermatillomania. These are mental health conditions that causes people to pull out their hair, scratch their bodies, pick at their skin. And they are chronic conditions that can be hard to manage. But there are ways that you can help your child who is struggling with it. So today we're going to learn the signs and symptoms, its causes, the treatment options, and then stick around to the end because I'm going to finish by giving parents tips to support their children struggling with trichotillomania and dermatillomania. So let's get started. All right, what is it? Trichotillomania, also known as a hair pulling disorder, is known for its irresistible urges to pull out your hair from your own body. And people with trichotillomania may pull out their hair from any part of their body at any time of the day. But the most common areas to pull out their hair is from their scalp and their eyebrows. Still, people with trichotillomania have also been known to pull out their eyelashes, their facial hair, nipple hair, chest hair, armpit hair, leg and arm hair, and even pubic hair, despite trying to stop. Now, similarly, dermatillomania is the impulsive urge to scratch, dig, squeeze, or rub at the skin obsessively. Both of these are obsessive compulsive disorders. So it is part of the OCD family, and they can cause bald spots and sometimes even permanent scarring. Now, before we go any further, I want to say, me too, my kid. Yeah, even impactful parents. For me, my child, where it showed up was more of the dermatillomania, where they were picking at their neck, picking so much, just scratching here, that it did leave scarring. And even sometimes my child who would do this subconsciously wouldn't even know that they were doing it until they saw blood on their hands. Another way this manifested in my own child is through picking at their feet. Literally picking at the calluses on their feet to the point where it was just badly dug into, and my child's feet were so sensitive that at times they couldn't even walk. So I tell you that because you're not alone. And some of these symptoms and signs, well, let's get into that because besides the obvious signs of hair loss and baldness, for trichotillomania, it can cause hair to regrow even thinner and even be missing altogether. With dermatillomania, things like scars and scratches and scabs and different flesh wounds could be on the body. And I want you to be able to identify these in your kids because it's a lot more common than anybody is ever talking about. People with these two disorders, they may have really high anxiety. They can get skin damage. They'll have difficulty concentrating from time to time, and they can even have panic attacks. Many suffer from depression, and identifying and treating these disorders is really important. It shouldn't be ignored as a phase or just a weird habit. And although many kids will dismiss their habit to adults as, not a big deal, don't worry about me, it's also common for kids with these conditions to feel embarrassed about their hair pulling and worry about what other people might think about them. So many children will hide the evidence by wearing hats and scarves, long sleeves, and all the things to cover up their bald spots and their wounds. Now, the causes, the exact cause is actually unclear. It is believed to result from a combination of genetic and environmental factors. Some possible factors include genetics or DNA mutations, change in their brain chemistry, family history, and even the sensation of hair and skin that just feels different from the rest. With trichotillomania and dermatillomania, these are types of coping mechanisms for a lot of people, usually the result of stress, anxiety, and depression. And again, I get it. I was in your shoes. My child going through this did have high levels of stress and anxiety and even some depression in their life at the time. And this was definitely a coping mechanism for my child, which felt it was soothing. And again, completely done subconsciously without them even knowing they were doing it until later on. So, where does that leave parents with treatment options? Well, the primary treatment is habit reversal training. It's a behavioral therapy type. And this therapy helps individuals recognize situations where they're likely to pull their hair or scratch, and it teaches them to substitute other behaviors instead. For example, maybe clenching their fists can stop the urge from pulling out their hair instead. Or other treatments may include seeing a dermatologist to treat related skin problems or even skin damage. Some children may be candidates to get additional help from a plastic or even reconstructive surgeon who can help them with skin grafting for affected areas in their body. And certain medications may also be prescribed by a doctor, such as serotonin reuptake inhibitors. However, mindfulness techniques such as deep breathing and yoga and support groups and other coping strategies are usually tried first. Now, having said all of this, getting help from a healthcare professional is imperative. Consult a mental health professional for a proper diagnosis and treatment plan. If you see that your child has missing eyebrows, little bald spots on their head, or they've been scratching at their body, don't take this lightly. Go to a healthcare professional to get this checked out, because treating the hair loss or the skin wounds are really only a Band-Aid. It is crucial to discover the reason behind the hair pulling and the scratching and the picking to treat the anxiety, the depression, or whatever other root cause it may be. So let's get into how to support your child. I know that this is super frustrating for you as a parent. When I was in your shoes, I was like, what are you doing? Seriously, why do you have to do that? Just stop. And really, all of that language is extremely unhelpful. Although it's your first reaction just to tell your child, stop doing that. But remember, when it's done subconsciously and it's a coping mechanism, a lot of times we need to replace some of those behaviors. So the first thing you can do to help your child is reduce as much stress from their life as possible. Since trichotillomania and dermatillomania can often be stress responses for children, parents should consider reducing any kind of stress in their home that they can, that you have control of. The second thing you can do is even try some detox methods. Okay, so what are detox methods? Well, this is going to be a gentle detox that you want to look into for removing harmful heavy metals and chemicals and even toxins from your child's body. I highly suggest going to a family physician to talk about this type of method and to see what is going to be the best way to gently detox your child in a safe way and just to see if it works. Again, for some families, it's a miracle, and for others, they may not see results, but it's definitely worth trying. And I have to mention here as an option. The third thing that parents can do is enroll their child in cognitive behavioral therapy. This is where a therapist is going just to help your child connect their mind, their feelings, and their behaviors so that they're very conscious about when they're pulling their hair. It's a type of habit reversal therapy, also known as HRT, and this will likely be the first line of treatment with either of these disorders. And I highly suggest that you try it out. It could be very, very effective. The fourth thing that parents can do is increase their own awareness. Therapy can involve helping a child recognize their thoughts, feelings, and behaviors associated with the hair pulling, but this therapy also aims to increase the awareness of hair pulling and replace it with alternative behavior. So the more you can find out about trichotillomania and dermatillomania, the more you can help your child really cultivate and internalize some of these new forming habits so that you can help them get over the pulling, the scratching, and the digging. It's really important that you're going to be there to support your child and really understand what's happening. And the last thing you can do, which is probably the most difficult, is be patient. Yeah, I know, just be patient. It can be so frustrating, and parents don't understand why their child can't just stop. But work on your empathy and your patience as you help your child deal with this very real OCD disorder, and support them the best you can with as much love as you can. Because honestly, your child doesn't really want to do this either. They don't want bald spots. They don't want scars on their skin. So discovering what is really causing this and being patient with us can be so imperative for their success. They need your support. And remember that habits are very, very difficult to replace and take a lot of time. So unfortunately, your patience is not only might be the more difficult thing for you to do, but it's going to be the most important. So I know you can do it. If this information was valuable for you today, become a more impactful parent by downloading the Impactful Parent app. Now, the Impactful Parent app is free, full of episodes just like this one to help you in your parenting journey. And it's investing in your family so that you can learn warning signs of certain behaviors so you can stop the bad things before they happen, just like today. If you knew about trichotillomania and dermatillomania, then maybe you can catch the signs of scratching or baldness before it gets out of hand. And all of this, plus so much more, can be found inside the Impactful Parent app. So download it today. It's free to download, so you have nothing to lose. Just go to your app store, search Impactful Parent, and I'll be there. And if you'd like to, go to theimpactfulparent.com. You can also find the app there and discover all the things that the Impactful Parent has to offer. But until next time, you got this. I'm just here to help. Thank you for listening today. Remember to subscribe and share this podcast with a friend. And don't forget, the Impactful Parenting Podcast is an extension of the Impactful Parent community. Go to the Impactful Parent website and download the free Impactful Parent app so you don't miss a parenting tip that can help you and your family. Thanks for listening today. So go to theimpactfulparent.com and see you next episode.